Schizophrenia is a disabling, chronic, and severe mental health illness that affects more than 2 million Americans aged 18 and over. It is incomprehensible and frightening. People with this illness may not make sense when they talk or may sit for hours without moving or talking. Sometimes people with schizophrenia seem perfectly fine until they talk about what they are really thinking.
Some symptoms of schizophrenia include hallucinations, delusions, thought disorders, movement disorders, lack of pleasure in everyday life, trouble focusing or paying attention, and problem with working memory.
There are many causes of schizophrenia, both environmental and genetic. The illness occurs in 1% of the population, but occurs in 10% of the people who have first-degree relatives. Other recent studies suggest that schizophrenia may result in part when a certain gene that is essential to making important brain chemicals is malfunctioned. It probably takes more than genes to cause this disorder. Many environmental factors may be involved, such as exposure to viruses or malnutrition before birth, problems during birth, and other not yet known psychosocial factors.
Some treatments of schizophrenia include hospitalization, which is necessary during the acute phase of the illness. It is necessary when the patient is at risk because of suicidal thoughts or is unable to care for themselves. It is also necessary to treat delusions, hallucinations, or problems with drugs and alcohol. Antipsychotic drugs are currently the best treatment available, but they do not cure schizophrenia or ensure that there will be no future psychotic episodes. Psychosocial treatments help these patients deal with the everyday challenges of the illness, such as difficulty with communication, self-care, work, or forming and keeping relationships. Rehabilitation programs may include vocational counseling, job training, problem solving, money management skills, use of public transportation, and social skills training. Individual psychotherapy is another treatment and involves regular talks between patient and mental health professional. Another form of treatment is cognitive behavioral therapy, which focuses on thinking and behavior.
One person with schizophrenia was named Michael Hedrick, who was a writer in Colorado. Every day he would go home to his apartment and smoke pot, then lay on his couch and watch TV, or head out to a bar and get so drunk that he couldn't walk. And it got to a point where he would do this every day, and he began to see the world as mostly a random series of events rather than an overarching conspiracy plot. He put all of his confusion and thoughts into a book. Another person with schizophrenia was named Joshua, who was 17 and who was diagnosed at the age of 17. He was very confused, and his family was initially in denial of his diagnosis. But he has found comfort in being able to tell his story to others, and now works at the National Alliance on Mental Illness and has run a peer-to-peer program sharing his story.